Hey guys, it's Lori again. This video is going to be about diabetes primarily. I know it's not related to chronic pain, but it does interfere with my life as a result of me being type 2 diabetic. First, I just want to say that, and I say this in all the videos, there's nothing professional about my videos. I don't edit my voice. I make a lot of mistakes. I stutter. I have a lot of tics, nervousness. I take a lot of drinks of water because I have severe dry mouth from all the medications I'm on. So just please bear with me. I know I talk fast too, and I look down at my notes, so please forgive me. I'm trying to make these videos shorter because I know that people don't really like to click on a video and listen to 40 minutes because my last video was pretty long. Okay, so I'm going to try to make this quick. So I am a type 2 diabetic. I was diagnosed in 2017, okay, 6 years ago. I had no idea that I had type 2, okay, even though it runs in my family. My mother had it, she passed away. Her mother had it, she passed away. Her brother, sister, they passed away. I hate to sound so negative, and that's not necessarily the reason they passed away. I'm just saying that they're no longer here, but it does run in my family. Anyways, so from the start, I thought it would be easy to manage diabetes, okay? They gave me the machine to check my sugar every day. They put me on glipizide, metformin, which is like the main one that they put everybody on. I was on the 500 milligrams, 2 of those twice a day. And then I was also injecting Lantus, which is sort of like a slow-acting insulin. I was injecting that every day. And then they added Humalog, which is an immediate sort of thing. So if I check my blood and it's pretty high, if my blood sugar is high, then I go do the Humalog, maybe a little bit higher than usual to try to even out things. Excuse me. And it took a while actually to get the Humalog. So it took a couple years. I was on the Lantus, metformin, and glipizide. And I thought I had things under control. I thought I was eating right and doing things right. But my numbers were never like normal. They were always like 200 or like high 100s. And when it was in the 100s, I was like happy. But that wasn't good because my A1C, when the blood tests come back, my A1C was pretty high. So what ended up happening, 6 years, diagnosed 6 years now, last year, 2022 in February, the end of February, it was my son's birthday. I talked about this in another video. And we had dinner, okay? We had dinner, me, my son, my daughter, and her boyfriend. And it was a nice dinner. I had a margarita, like I really enjoyed the evening, and I took a salad to go. We were going to go bowling, but it was full, so we just went home. And so, like, I was tired, went to bed, woke up hungry. I was like, let me go eat that salad. Went to get the salad, ate it, and then I don't know if I laid back down. I don't know how much time went by, but all of a sudden, from then to the next few days, it's very hazy. I remember throwing up. I remember not passing out, but I did get woke up after I passed out one of the times. It was very scary. I was on the kitchen floor. My head was by the cat bowl, and I just remember opening my eyes and seeing all 3 of my kids hysterical. And they're like, we need to call 911. I'm like, no, you're effing not. And that's how my mother was, very stubborn. I said, no, you're effing not. I'm fine. And so they tried to get me up, I got on my feet to go to bed. I barely made it into my room, which is on the same floor as the kitchen, and somehow I got into bed. And then there was another episode. I don't know if it was the next day or the day before, and I don't want to get too graphic, but I had a lot of diarrhea, and I guess the whole bathroom, I destroyed it. I was so out of it, I had no idea what I was doing, and I had no control over my bowels. And thinking back, I just feel so bad that my kids had to see me like that. And so to this day, I vowed I will never let my diabetes ever get out of control. So after that, the next few days, I started having intense pain in my stomach. And this is, mind you, I had all that diarrhea, and then my stomach was hurting so bad that I was wailing. And I'm already in chronic pain around the clock with my back, spine, and pelvic pain. But this is the kind of pain that wouldn't go away no matter which way I laid, no matter what I did, if I stood, tried to walk. And just for a few days, I was so stubborn. I was just crying, just praying to God it would go away. And then my oldest son finally said, "You need to go to the ER." Sorry for the drinks. Dry mouth again. And I agreed. I couldn't take it no more. I did not want to go to the ER. So I went to the ER. My blood sugar was whatever, out of control. I don't know, even to this day, why my stomach pain was so bad or what that was, or if I was backed up. I really don't know. So anyways, they admitted me to the hospital, and while I was there, they ran every test you can imagine. Oh gosh, it was bad. It was 7 days in the hospital, guys, for diabetes, to get it under control. And then I had to get a colonoscopy, which I did not want to get, and it was so painful. The prep. If you've had a colonoscopy, then you know what it's like. You know the whole thing, what you have to go through. The worst part is taking that medicine. And so every time I would have to relieve myself as a result of the medicine for the colonoscopy, it hurt so bad I was screaming and wailing. Nobody even came in my room. No nurse came in my room, nobody. I didn't call anybody either. I really didn't want anybody to come. I needed to get it off my chest. And then I knew that I had to keep drinking that stuff because they would not give me the colonoscopy unless I'm clear. You know what I mean? Your bowels have to be completely clear. And so I just kept taking the medicine, relieved myself. It hurt every single time. I stayed up all that night worried that I would not be able to get the colonoscopy because I was worried about if I was going to be clear, if my bowels were clear. And so yeah, I stayed up all night worried about that because I didn't want to have to do it again, you know. And they just wanted to roll out stuff because, you know, my stomach hurt when I came in, and they didn't, you know, they didn't know why or if it was how that's related to diabetes. To this day, I don't know what. I don't know if they're related or not. But they did that, and I understand why they did that because I was crying in pain in my stomach, and they did everything else. And so that came back, and then while I do want to mention, while I was there, they did give me pain management around the clock. I will say that. They knew I was a pain management patient, so they did give me, every 4 hours, they gave me pain medicine. So I will say that they were good to me as far as that. So, you know, they did all these tests. Oh my goodness. All these different blood tests and CT scans, and everything came back okay. And then with the colonoscopy, the doctor came in the next day and he said, "You have C. diff." Okay, I had heard of C. diff, C-diff. And he said I had that. I knew it was something contagious. Okay, I knew it had something to do with the bowels, or if you touch something gross or bowels, you get it. It's very contagious. And so everybody knew on my floor, okay, that I had it. And so there was a whole procedure that everybody that came in, every single buddy, a visitor, family, doctor, they had to literally get a whole suit, you know. They had to suit up, like not hazmat, but you know, like a whole nother like gown piece. They had to do a head thing, everything, because if I have C. diff, I'm severely contagious and they could get it. So the procedure was that the minute they come in, they dress up, and then they come in, even if it's just to take my blood sugar, they still had to go through the whole thing, and another way out, they would take it off and wash their hands. And so my nurse, she was pregnant, okay, heavily pregnant. She was sweet, but I think she wanted me off the floor. I think I was on a hard floor. I don't know why, but I just overheard her saying, like, we need to get her off the floor, blah, blah, blah. I think it was because that's C. diff. So I wasn't offended because I thought, if I'm this contagious, then no, she's pregnant. Of course she wants me off the floor. so she was, you know, campaigning for that. And then I had other doctors come in from my regular PCP, and the minute they walked in, I said, I have C. diff, you know, and they just left. Everybody was so scared. I was so embarrassed because I kept thinking, oh my God, they have to go through all this stuff just to come in and take blood or do this. And so I went through that, and they gave me antibiotics, all kind of antibiotics for that. Oh my goodness, continuous, okay? So I'm just going to end this real fast. I did see an endocrinologist before I went home, and she said, let's have a visit in 3 months, a video visit or whatever in 3 months, and we went over the diabetes stuff and Humalog. That's when the Humalog got brought up, because that's an instant insulin, and that would help control my numbers, you know. So if I took my blood sugar and it was, say, 250, I could immediately eject maybe 3 to 5 units of the Humalog, and then it would keep me level. And so that helped a lot. That really did help a lot. And so that was before I got released. And for some reason, they did finally move me to another room. This was like day 7. Okay, at this point, I was ready to go home. I mean, you know, you get no rest in the hospital. It's not fun. The only decent thing was they help pain control. But it wasn't like, oh my God, I feel so much better than when I'm at home. They just maintained my pain control, just like if I was at home. So day 7, I'm downstairs in this really weird room. It's almost like they made it when COVID was really like active, because the room was like shut off, and it was just really weird. And so I'm just going to follow up with this real quick. So, and this is kind of funny, I talked about it in another video. So my not endocrinologist, my gastro doctor that did my colonoscopy, he came in, the nurse was looking at my chart and typing stuff in, and he came in, he's like, oh, Lori Martin, okay, yeah. And she's like, yeah, she has C. diff, right? He's like, no, she doesn't have C. diff. Are you freaking kidding me? You're telling me I just went through all that embarrassment? All those people were afraid to be near me, couldn't have conversations with me. They had to go through the whole 9 yards of putting a whole nother uniform on because they didn't want to get what I had. And he's coming in and saying, I don't have C. diff, which is great, right? But how do you misdiagnose somebody? You know, it's just things like that make me wonder, you know, because it just makes me go back to 2010 when I had a hysterectomy and I did not need it. The doctor said that I had endometriosis, 2010, this is the year my pain started. And then after they took my uterus out, I find out I didn't have endometriosis. What are you going to do? These are the type of things that went on in my life. And I know all you guys have a million stories. Oh gosh, I can only imagine the stories. So I just kind of wanted to get that out there about the diabetes. Just to sum it all up, the last time I had my visit with the endocrinologist, she's just very happy with my blood work that I had last given. My A1C, all my numbers were good, and she said that I can stop taking the Humalog and the Lantus. So that was 2 injections she took me off of. The Lantus, which is the short-term, you know, insulin, and then the Humalog, which is kind of like a rescue, like just to get your numbers right. And she took me off the glipizide, and she kept me on the metformin, but I don't even need it. I don't need it because my numbers have been good, and I'll tell you why. I'm on Mounjaro, and if you don't know what Mounjaro is, look it up. M-O-U-N, I probably spelled it wrong, Mounjaro, M-O-U-N-J-A-R-O. It's kind of like Ozempic. You hear the commercials about Ozempic and how it's good for diabetes and weight loss. And you hear about celebrities trying to get their hands on it for weight loss. So in my case, it was for diabetes, but it was for weight loss. And yes, I have benefited from that. I've lost 40 pounds. So, and I needed to lose weight. I'm only 5'4", and I'm too heavy. At least I think I am. So the Mounjaro is amazing. I mean, my doctor, she told me straight out, you know, this Mounjaro, You know, if you don't have the side effects, it's really going to help you. It's going to help the diabetes, and you're going to lose weight. And so that's happened, and like I feel so good about this part of my life, the diabetic part, because I really did not control it the way I should have for the first 5 years. And so of all the things that I'm battling, you know, the chronic pain, mental health issues, and then diabetes, this is one thing, the diabetes is one thing that I can actually control. And so I'm just, you know, I'm very grateful for my endocrinologist. You know, it took years for me to get to this. I wish they would have just gave that to me from the beginning, but I'm assuming you have to work your way up. And so there's a bunch of doses. Like it's just like Ozempic. You start out slow, 2.5 milligrams, and then 5 there's 6 different ones. I'm at the top. I'm in the 6th month, and so I feel really good as far as that's concerned. Does it take away my pain? No, that's a whole nother issue. That's why I did this video about diabetes. However, of course it interferes with my pain. Of course. It's one big circle of things that I have to try to control in my life. You know, the chronic pain I can't really control. I mean, you could say I could by trying more things like moving my body more, which I am, and just different things. But this is diabetic. This Mounjaro has really helped me, and I highly recommend it. If you can get your doctor to, it's Mounjaro, and then there's the Ozempic. Different insurance companies cover different things. Because my sister is a diabetic, she's older, and they put her on Ozempic. And then there's another one below that too. I think mine has maybe a different ingredient. I don't know, but I just wanted to sort of go over my diabetes story real quick. You know, it was rough the first few years. It was rough. They canceled my spinal cord stimulator surgery because of my sugar levels being so high. That was 2017. Yeah, 2017. This is before all the, you know, Mounjaro. When I was supposed to get my spinal cord stimulator out, they said your sugar's too high, and I was heartbroken. So I did bring it down, and everything worked out, and then, you know, I got the spinal cord stimulator taken out. So that's my story on diabetes, a quick overall. If you guys have any questions about the Mounjaro or any of that, let me know. If you're on Mounjaro, let me know. If you are on Ozempic and it's helping, I'm very curious about the different types of these diabetic injections. Mounjaro, so I inject every Monday. I inject and then I throw away the pens. So you get 4 pens for 4 weeks. You do one every week and then you just toss them. So I am curious about comparing Mounjaro to people that take Ozempic, and I can't remember the other one. But that's my story on diabetes, and that's it, guys. Under 20 minutes. Bye.